Yeah, this is the World Glaucoma Week, which we are observing from March 7th to March 13, 21. And as we are all aware, glaucoma is a silent thief of sight, and it concerns all of us because many of our patients are suffering from glaucoma and they don't know that they have glaucoma. What exactly is glaucoma? Glaucoma is the name given to a group of related eye diseases in which the optic nerve is damaged. Basically, the nerve of the eye is damaged. And the nerve is a very important thing because it carries all signals from your eye to the brain, connects the eye to the brain. Therefore, it's very important that this disease is picked up in its early stages. So we are aware that the eye works like a camera. So if you take a picture in a camera, you have a lens, you have the different parts of the camera, and you also have the eye nerve, which is like the back of the eye, and that's the main cable connection from the eye to the brain. That's the most important part of the eye, which is the optic nerve. The optic nerve is the problem in glaucoma. So when the eye pressure increases, we have a range of eye pressure. When the eye pressure increases to a particular level in which the nerve starts getting damaged, then this is called as the fluid pressure, intraocular pressure, at which the glaucoma starts appearing. So we need to know that one of the factors that causes glaucoma or the eye nerve damage is the high intraocular pressure or the fluid eye pressure in the eye. The eye pressure is actually different from the blood pressure. Many people and many patients would confuse the pressure as being blood pressure. This is not blood pressure. So what is this eye pressure? So obviously there's a fluid inside the eye. It keeps coming. There is a balance of what comes in and what goes out. And in patients with glaucoma, either there's too much of fluid coming in or the fluid inside there where it goes out of the eye. So therefore the pressure starts out the optic nerve. So it's the basic principle of how to understand the eye and the eye pressure is that you have the analogy of the wash basin and the tap. You open the tap, you get water, and the water goes out through the drainage channel. Suppose I block the drainage and the water keeps coming in. So obviously the water doesn't drain out and your fluid pressure builds up. So the faucet actually is allowing the fluid in, and the drain is actually getting clogged. So that's what results in a fluid eye pressure being built up inside the eye. So the eye's got a limited capacity to stretch, and therefore the pressure in the eye goes beyond a particular point. The nerve starts to get damaged, and when an eye doctor or an eye specialist looks into the eye and looks at the optic nerve, the eye nerve, we know that the nerve is getting damaged. So the appearance of the eye nerve tells us that this is possibly glaucoma, this is early glaucoma and mild glaucoma and so on. Basically, gets damaged due to the rise in the intraocular pressure, the eye pressure. So what causes this glaucoma? Fluid pressure inside the eye. Some other causes are also there for glaucoma. Sometimes you can have a so-called apparently relatively normal pressure, but the blood supply to the eye now can also get affected. That's another cause for glaucoma. So glaucoma is usually due to raised intra-eye pressure. Some people can have raised pressure or glaucomatous kind of eye nerve damage without having a very high pressure. This is called normal tension glaucoma. Normal tension glaucoma has other reasons besides the raised fluid pressure in the eye. Generally, there are no symptoms. Glaucoma, generally, there are no symptoms. Some people may have blurred vision, some mild halos around colored lights, rainbow colors around light. But the symptoms are usually rare. Most people with glaucoma will not have any symptoms at all. They're usually asymptomatic, diagnose the glaucoma. So how does it worsen? In the early stages, people will have no symptoms at all. The vision is normal, and slowly, as the eye now gets damaged, you may start seeing visual field changes. As you look straight, the side vision, what you see in the sides may slowly get affected. That also in the mild stages and moderate stages, most you will find people start losing their vision. So that is the problem. It is silent, it is asymptomatic till the eye nerve is affected to a significant in the eye nerve and diagnose the glaucoma. And depending on the width of the fluid drainage channel in the eye. And the closed angle glaucoma is somewhat more common in Asian eyes than in the West. So both types of glaucoma are diagnosed by a test called gonioscopy. And this test is usually done by an eye doctor and cannot be done by anybody else. So you must undergo a complete eye exam, which includes the vision, the eye pressure, this kind of a gonioscopy, and looking at the eye nerve with a detailed examination called the fundus examination and so on. So these are the tests which we do for glaucoma. Tonometry for the pressure, looking at the eye nerve called ophthalmoscopy, and the perimetry is called the field test or the visual field test. And of course, I told you gonioscopy is to see where the drainage channel is it open or not, and some other tests like information from all of this tests is put together, and only then we come to a conclusion as to the type of glaucoma and the nature of glaucoma and severity of glaucoma. There is no one single test for glaucoma. So once we diagnose glaucoma, what do? We usually start off with eye drops. Yeah. So how is glaucoma treated? I think we already seen as to how what is glaucoma, what causes glaucoma, and what are the types of glaucoma. How is glaucoma treated? Glaucoma treatment is generally depends on the type of glaucoma and the stage of glaucoma. Usually, we start off with glaucoma medication. Usually, it's 1 or 2 eye drops per day, sometimes more. In some people, the laser treatment works, like the YAG laser for angle-closure glaucoma and the SLT laser for open-angle glaucomas. So, glaucoma laser is also available. For advanced glaucomas, when the laser and the medicine is not enough, we advise surgery to reduce the intraocular pressure. There's so many types of surgery, modern surgeries are also available. And but what the patient and what one should realize is that the glaucoma damage is permanent to the optic nerve, and medicine and surgery will help to control it. And there is no total cure for the glaucoma, so a lifelong follow-up becomes very, very important for the patient. So, who is at risk for glaucoma? One may ask now, how do I know am I getting glaucoma or not? What is the risk factors for glaucoma and so on? So, generally, people who are older age group of 40 and above and who have been using steroids of any kind for asthma, for skin problems, for health problems, and so on. So, steroids can cause glaucoma. People with high minus power and myopia, people having diabetes and blood pressure, family history of glaucoma is very, very important. Father, mother, brothers, sisters have glaucoma and so on. Have had an eye injury in the past and have very high intraocular pressure on diagnosis and so on. These are all the people who are at risk of developing glaucoma. So to summarize, glaucoma is a disease where some people could have raised intraocular pressure with high eye pressure. Some people could also have what is called as normal intraocular pressure. The key to the diagnosis of glaucoma is basically picking up the damage to the optic nerve, and the key factor is the element of in the element of diagnosis is the appearance of the optic nerve in glaucoma. And of course, we do other tests like the eye pressure, gonioscopy, visual fields, and many other sophisticated tests like imaging are also available. So it is not one single test. You need a comprehensive or a complete eye exam for us to pick up what is glaucoma. What do you need to do as far as a patient is concerned as a patient? If you are elderly or if you are over 40 years of age, a family history of glaucoma, been using steroids, have high myopia, please get your eye tested without fail every 6 months to a year. And know that glaucoma is treatable. Glaucoma can be stopped from getting worse. And you need periodic eye checkup. Get your family members also for a checkup in case you're diagnosed to have glaucoma. What you should remember is that the vision loss in glaucoma, what has already happened, is not reversible, but further loss can be stopped by appropriate treatment. So timely diagnosis, early diagnosis, and appropriate treatment are the key to preventing blindness due to glaucoma. So I thank you all for a patient listening. And as it happens to be World Glaucoma Week, I think in our endeavor to promote and increase the awareness about the glaucoma disease itself, I think so many of us are joining hands. And I thank all of you for participating in this awareness initiative. Thank you, one and all. There is also a glaucoma simulator if people would like to know how it feels to have glaucoma. You can look up this YouTube channel and video on how glaucoma affects your vision and how does it actually feel to a patient when they have glaucoma. And some other YouTube videos on how the intraocular pressure, what happens in the fluid inside the eye, and some simple videos on how the eye pressure affects the optic nerve in glaucoma. Thank you all.